Low sperm count is one of the major causes of infertility in men. Actually, knowing how to treat it and getting the home remedies can save a day. Most families, most couples, when they fail to get a child, the blame is always on a woman. However, this is not true. Most men are actually infertile, and the largest or the most common cause of infertility in men is low sperm count. In this video, we'd like to look at what low sperm count means, what you can do, what home remedies, which treatment can you get in order to get rid of low sperm count and have the happiness in your family.
Ask Dr. Uthuman on Sawa Wall.
Hello my very good viewers, welcome to Ask Dr. Uthuman YouTube channel, a channel where you learn medicine at the comfort of your living room. I told you if you'd like to get in touch with me to make a private consultation, go to my website www.druthuman.com, make an appointment, I will get in touch with you online. And today we are continuing with our videos you guys are sending, and let's first look at this lady.
Hello doctor, good morning. My name is, I live in Germany. Please help me, my husband and my fiancé. Since 4 years that we have been together, that we have been trying to get to have a child. He's not coming forth. We are bad planning for marriage, but it's not coming forth. So last month, we decided to go to the hospital to see what was the problem. So the doctor confirmed it that my fiancé has low sperm count. That he has low sperm count, but they gave us an appointment. The appointment they gave to us is 3 months time. It's very far. See, please, what kind of remedy can he be taking at home that can boost the sperm?
I think her question is self-explanatory. She's talking about low sperm count, and we are also going to talk about this very animal called low sperm count. First of all, what is a sperm? A sperm is a male or a man's reproductive cell. This is the cell that is responsible for fertilization of the egg in order for a woman to get pregnant. Therefore, if this cell is not present, a woman cannot get pregnant. Now, this is an advice to every couple. Once you see that you're not producing, a woman is not conceiving, let's not look at only the female factors. Let's not blame this woman alone. A man should also go and analyze the sperms. So there is a test called semen or sperm analysis. And once you do it, you're able to know that yes, I am viable, I can impregnate someone, or I cannot. Therefore, I encourage you to go and do such tests. Now, for someone who has done this test, when will you know that mine are not okay, they need some interventions, or mine are normal, and therefore we should look at the woman's factors. So let's look at the parameters and the normal values. When will you say my sperms are normal, and when will you say they are not normal? So when you go and do this test, results will come out in this form. Number one, we are going to look at is the volume. So when a man releases, we measure the volume of the substance he has released. And this volume is supposed to be somewhere between 1.5 to 7.6 mils. I guess everyone knows how to measure these mils. So if someone at least ejaculates here, we should say something around 1.5 to 7.6 mils. So if it is low, then we start putting question marks, a lot of question marks about the fertility of that gentleman. If the volume is below 1.5 mils. The other parameter we look at is the total number of cells in that ejaculate. In this substance, how many cells are there? The total number of cells. The total number of sperm cells. They are supposed to be at least 39 to 928. 39 to 928 millions. 39 to 928 millions in just a single ejaculation. In a single release, a man is supposed to release between 39 to 928 millions. Oh, men are very rich. So if the count, if the number of cells is less than 39, then there is a problem and an intervention must be made. Then this was like the total number. But what if we look at, if we take only 1 mil, so 1 mil of this total volume should contain at least 15 to 259 millions, to 259 million cells. We said that whole volume, the whole release should contain at least 39 to 928 millions. Anything below this, abnormal. But if we decide to take only 1 mil of the whole of this, only 1 mil, then it should contain at least 15 millions. That is between 15 to 259 millions. I told you men are very rich. So if you go below 15 millions, we start talking about this animal. There are some other parameters, because this is a quantitative analysis. We are counting. We are trying to count. But again, there are some other qualitative factors we shall look at. But another quantitative factor, something else we look at, is the motility. Motility, speed, movement. Yes, we have seen this number of cells. There are many, they are there. But are they moving? Are they moving? Do they have speed? Because I told you, remember in one of my videos, that this cell, once it reaches the V, it is supposed to swim very fast. It navigates through, enters the cervix, it passes through the uterus, the uterus. It has to go to the fallopian tubes and meet the egg. Therefore, it should be a motile cell. There are some cells that are not motile. Now, this is where we come to two parameters. One is called progressive motility, another is called non-progressive motility. When you analyze these cells, you'll find that some of them are moving in a straight line. They are like a swarm of bees moving in a straight line. That is what we call progressive motility. But you find that others are just rotating around there, moving in a vague direction, and that is called non-progressive motility. So for the progressive, they are supposed to be between 32 to 75%. So when you get these cells, we should find at least between 32 to 75% of them moving in a straight direction. Then those that this is progressive, then those that are non-progressive, I told you non-progressive are those that do not move in a straight direction. They move in a zigzag direction, they come back like that, like that. Those ones should be at least 40 to 80%. Please, these values may look so weird, but when you go to the hospital, to the lab, they do that test. Try to look at these values. You can also analyze it yourself before even the doctor explains to you. If you see something progressive in progressive motility and it is below 32, there is something wrong. If you find non-progressive below 40, something is wrong again. And then the last part we look at on the qualitative survey is the vitality. Vitality. This is very, very, very important. Vitality. What do we mean? Vitality will look at the number of live cells. Because there are some people who fire non-live bullets. People who fire rubber bullets, tear gas. So, this part, if the sperms, if these cells are not live, of course, you'll be doing nothing. Therefore, the number of live cells should be at least greater than 58%. When you release like this, we should be able to see live cells above 58% of what you have released. Anything below 58%, we call that abnormal. And that is where questions start arising. Now, after the quantitative survey, that is counting, we now go to the qualitative survey or the qualitative analysis. By qualitative analysis, we look at this cell and look for any abnormality. But before that, let's look at how a normal cell looks like. Don't mind my drawing. So, this is basically how a normal cell is supposed to look like. Don't mind about my drawing, but let's look at the parameters, the normal parameters. So, this cell is supposed to be, the head is supposed to have 3 parts. And that is, number 1, the head. This is the head. This is the mid piece. And then the tail. So a normal cell is supposed to have 3 parts: the head, the mid piece, and a tail. Now morphologically, if you observe this cell and it is missing any of these parts, it's abnormal. And if it's abnormal, it will not be able to perform its function of fertilization. The head is supposed to be oval. By oval, if you look at an egg is oval in shape, and the head of this cell is supposed to be oval. Now, if you look at the length of this head, that is from here up to here, the length of the head, it should be about 5.6 micrometers. 5.6 micrometers. You may ask me, you may tell me, I don't know how to measure a micrometer. Don't worry about it. Just look at the lab report they will give you. And on the lab report, they will put the length of this head. And if it is below or above 5.6 micrometers, then somewhere, somehow, there is a problem. And now if you look at the width, because this is the length, there is this. This is the length and this is the width. So from here up to here, that is, we call that the width. It should be between 2.5 and 3.5 micrometers. So from here up to here, it should be between 2.5 to 3.5 micrometers. So that is how we assess the head. Why should we mind about the length and the breadth or the width of this head? It is because if some people have a poor morphology whereby they have a very big head. So a sperm cell with a very big head will not be able to penetrate the egg. Remember, the egg has a barrier. It is not easy for this sperm to penetrate the egg. The egg has a lot of obstacles, and therefore a big-headed sperm will not be able to hit the target, will not be able to penetrate the egg in order to cause fertilization. And therefore, these parameters are very important also to note. You may be having enough cells firing your bullets like who? However, when those bullets are not well shaped, my friend, you may not get a product. So we look at this. Then secondly, we now come to the mid piece. We come to the mid piece. This mid piece should be thinner than the head. So the head should be bigger than the mid piece. If you find the head is very small and then the mid piece is big, still this cell will not work for you. Therefore, this mid piece should be thinner. By thinner, we mean it should be smaller than the head. And then lastly is the tail. This tail should also be smaller than the mid piece. It means the tail should also be, it should be the thinnest. It should be the thinnest out of all the parts. And also, the length of this tail should be at least 45 micrometers. This tail should be long enough. It should be 45 micrometers. Why? Because it's the one that swims. Even the swimmers, most of them, you use your legs to swim. So this tail is the one that beats around that negotiates and finds and makes sure that the head is penetrating the egg. Therefore, the tail should be at least 45 micrometers. If it's very long, again, it won't be able to move, because you know when it is very long, it will be heavy for this sperm to swim faster and reach an egg. So now, what can cause the low sperm count? And by low sperm count, we said that in the whole volume, you have less than 39 million cells. And then in just 1 mil, you have less than 15 mils. What can cause that? Number one is bacterial infections. Most people take this lightly. And when they have low sperm count, they look at several other things. But number one cause of poor production of these cells is bacterial infections. So there are several bacterial infections like streptococcus, staphylococcus. Just know that those bacterial infections, all infections that affect the testes, that affect your balls, can lead to low sperm production. And therefore, when we come to the management or treatment, we shall be looking at how we can be able to treat them, because they are a major cause. Especially, there is a bacteria called E. coli, and several other bacteria can lead to low sperm production, and therefore, you'll have a poor or a low count. Something else that can cause this is trauma, accident. You can get involved in an accident, or you're walking somewhere. Actually, there are some accidents that are jokeable, whereby someone, the eggs are maybe down, and then by the time you sit on them, and then they get injured. So if your eggs or your testes are injured, then they can lead to poor production, and at the end of the day, you have a low sperm count. And then something else which is also very serious is what we call autoimmune disorder. There is a disorder called autoimmune, whereby your own antibodies fight against these cells, and that is called autoimmunity, whereby your own defense cells, because everyone has the defense cells, the white blood cells. Now you find that someone has defense cells that are seeing these cells as a foreign body. You have a high defense. You have soldiers that look at your sperms as if they are aliens, that look at your cells as if they are not supposed to be in the body. And what is going to happen is that your own cells, your own defense, your own immune system is going to fight against them, thus killing some of them, and at the end of the day, the volume or the count will go low. Another cause we can talk about is cysts development. Do you know that also men have cysts? You only thought that women have ovarian cysts and so on, but even men have cysts, and a man can develop cysts in their testes or in the scrotum, and this cyst will affect the production of your cells, and thus you have a low count. And something else which people need to also look at is the genetics. Genetics. So there are some genetic abnormalities that lead to poor production of sperms. For example, people with Klinefelter syndrome, and these are chromosome abnormalities. This is something where I don't know how I can explain to you, my viewers, but it is an abnormality. Someone is born with it. You are born with an abnormality, and that abnormality cannot allow you to produce a good quality of sperms, and cannot allow you to produce mature sperms, and therefore you end up having a low count. So just know that genetics contribute to that animal called low cell count. And then something else is called retrograde ejaculation. Retrograde release. This is the process whereby, because normally when a man releases, these cells are supposed to pass through the vas deferens into the urethra. Now this time, instead of entering the urethra, they will instead go back into the bladder. And therefore someone will have their cells deposited into the bladder rather than into the urethra. Therefore someone will not be able to release the sperms into the V. Those stuffs will be taken back into the bladder, and therefore you not have a normal count. Then another cause which is also very important is hormonal imbalance. If you thought that hormonal imbalance exists in women alone, you're wrong. We can also have hormonal imbalance in men. Which hormones can be imbalanced in men? We have this hormone called testosterone. That hormone called testosterone. Another one called follicle stimulating hormone. Another hormone called prolactin. Plus several other hormones. Now, if these hormones, for example, testosterone is the one responsible for production of these sperms, this one is the one responsible for maturation of the cells. If these hormones are not balancing, if you have either any of them low in amount or in quantity, then you will not have a good production, and at the end of the day, you may have a low sperm count. Then something else is medications. Some people, for example, the people who are hypertensive, people who have pressure, a disease called pressure, what you people call pressure, and they are on drugs called beta blockers. Now, my friend, how will you understand that this drug is a beta blocker? If you are on drugs for pressure, all antihypertensive drugs, and their name ends with lol, just know that that drug can have a side effect of low sperm count. An example of those drugs are propranolol. This drug called propranolol. Another drug called bisoprolol. Another drug that is also very common called atenolol. These drugs, all those beta blockers, all those antihypertensive drugs called beta blockers can affect the count of your sperms. And therefore, if you are having pressure, high blood pressure, and you are on such drugs, and you're finding yourself not able to give birth, not able to impregnate someone, then think about this, talk to your doctor, discuss on how to probably change to other classes of antihypertensive medications. Then something else that can cause a low cell count is undescended testes, and we can mix undescended testes with absence of testes. There are some people, you remember, when you're still in your mother's womb, when you're still young, a fetus, the testes and the man's organ, they are within the abdomen. And then as you grow, they descend or they flow downwards. They descend, pass through the abdominal walls, and then come to the area where they are supposed to be. Now, to some individuals, the testes don't descend. Other things form, no? You may look at someone as if they are normal, but in the scrotum, there is no testis. Lastly, I will talk about is diabetes mellitus. Diabetes mellitus. If someone has diabetes, in my language we call it sukari. If you have sukari, if you have that diabetes can lead to low production of testosterone. It suppresses the production. There is some biology there, but there is suppression of production of testosterone. And we said that testosterone is very important in manufacturing of sperms. Therefore, these are the causes of low sperm count. We have looked at the main causes, or what we call the medical causes of the low sperm count. But there are some other things we have to look at which are also very important, and those are the social and lifestyle issues. Social and lifestyle causes are very serious. These are behavior, these are things we do normally, sometimes knowingly or unknowingly, and can expose us to having a poor or a low sperm count. For example, overheating. What do I mean by overheating? There are people who go for hot bath, the saunas, the steam bath, and so on. Those ones are very dangerous to your sperms. Why? Because when you overheat your body, you also overheat the testes, and thus raising or increasing the temperature of the testicles. And when the temperature of the testicles is increased, then the sperms are going to be affected. And at the end of the day, you'll be infertile. You'll be infertile. For you think you're enjoying the sauna, you're enjoying the hot bath, you're enjoying the massage and so on, but it is exposing you to this. And therefore, if you're one of that kind that has a low sperm count, the doctor told you have a low sperm count, and you know that you usually go for saunas and hot bath, then you need to change. Another factor we can look at is overweight, or what we call obesity. Like I told you in one of my videos that I have not seen anywhere where obesity or overweight is important for human health or for the human body. So in this case, again, obesity is bringing issues with the sperm count. What does it do? It interferes with the production of testosterone. And once testosterone production is interfered with, it means the production of our cells is going to be interfered with, and thus a low sperm count. What else is alcohol? Alcohol, drug abuse, smoking, marijuana, and so on. All those ones can affect their risk factors to having a low cell count. Something else is exposure to chemicals. Exposure to chemicals and heavy metals. For example, paints, those painting materials, pesticides, and so on. Lead poisoning, those metals, heavy metals like lead. So if you're kind of a person who works in such environment of painting, pesticides, heavy metals, and so on, just know that you're also at risk of having a low sperm count. And now, if you find yourself, if the doctor tells you that, my friend, you have a low sperm count, then look at what you do. Do you take alcohol? Are you smoking? Can you try and change something? So, and because if you change probably those things, then you can have a normal production and your levels go high. And lastly, I'll talk about in the risk factors is stress, chronic stress. There are people who are chronically stressed. They are depressed. Of course, those conditions can lead to a low sperm count. Now, I know what all of you are waiting for is the treatment. How can we treat this? Let's look at how you can treat this. So now, friends, when we are looking at the treatment or how you can improve the low sperm count, you must first of all understand the cause. We must be very clear here. You have to first of all know the cause. What is causing my low sperm count? If you find out that it is the infections causing your low sperm count, then of course we are going to give you antibiotics. Antibiotics, we talked about the other E. coli, the streptococcus, the staphylococcus. So if it is the epididymis that is leading to a poor production or a low production of the cells and thus a low cell count, then it means we shall give you antibiotics. Therefore, the number one medical treatment is antibiotics in case it's the bacteria disturbing you. Then second, which is also very important, is hormonal replacement therapy. Why do we give hormonal replacement therapy? If we find out that the problem is hormonal imbalance, then we shall give you the hormones. We shall add the hormones that are missing. For example, we give follicle-stimulating hormone. There is a drug called luteinizing hormone injection. If we find out that the problem must be on the luteinizing hormone, then we shall give it to you. I'm talking about these hormones, FSH and luteinizing hormone. Someone may think they are for females. No, even in men, we have those kind of hormones. So medicines we can also give is clomiphene. Clomiphene, this is a wonder drug. Most people, when I talk about clomiphene, they talk about getting twins. They think it's they are hormones for women, they are medicines for women. No, even men can be given clomiphene in order to improve on their count and production. Another drug is called anastrozole. Anastrozole is also another wonder drug which can be used. Another drug is called letrozole. Letrozole is also another hormonal replacement drug which can be used. Therefore, if the problem is hormonal imbalance, then we shall give you those hormones to replace what is missing. Then something else we can do is surgery. When do we do surgery? If we have varicose veins. Remember, one of the causes of low sperm count or low production of sperms is varicose veins. What are varicose veins? Varicose veins are like those blood vessels, all the veins that are on top, and they are very big. You find that this is the scrotum, but there are a lot of veins surrounding it, blood vessels surrounding it. Okay? So because there are a lot of blood vessels surrounding this, it means this stuff is going to have an intense blood supply. And once it has intense blood supply, it means it's going to increase or raise the temperature of the testicles. And when the temperature of the testicles is raised, of course, you know what will happen, like a person in a sauna. So what we do is to do varicose surgery, if possible. Then another treatment I can talk about is a drug called Mannix. This medicine is a very controversial one. Why? Because there are a lot of reservations by several doctors about this medicine. But some researchers have shown that this medicine actually works on improving the motility and vitality of the sperms. There is a research which was done by Sande Odunke and others, or Sande Odunke et al., and it showed that Mannix can increase the motility of your sperms by 124%. It increases the motility, the speed, the progressiveness of your sperms by 124%. And it also showed that this Mannix can increase the vitality of your sperms by 4-folds if you take these medicines for a period of 3 months. And therefore, I would recommend someone to take these medicines for a period of 3 months in order to improve the motility and the vitality of the sperms. Now let's look at the prevention, the home remedies. What can you do? What can you do in order to improve the sperm count, in order to improve the motility, in order to improve everything around there, to increase your chances of having children or increasing the chances of fertility? Number one is timing ovulation. What do I mean here? You know your sperms are very low, and therefore you want to give them that day, you want to produce them on that exact day where your lady is fertile. And therefore, we advise that time your intercourse on the ovulation day. And I have taught about how to calculate the ovulation day of a woman and so on in several videos. So if you know, if you've been told that your sperm count is low or the vitality or anything, there is something wrong with your cells, then it is better to time ovulation. Something else you need to avoid is avoid lubricants. You already have a low count. The quality is low, the quantity is low, and then you're using lubricants. They will affect the motility, they will affect the vitality of your cells, and therefore you should avoid them. Something else is quit alcohol, quit smoking, quit marijuana, quit drug abuse. If you're told that your sperms are low, and you know that you are an addict of those items, alcohol, smoking, drugs, and so on, marijuana, then, my friend, try and quit those substances. Something else you need to do is to exercise in order to maintain a normal weight. We already saw that overweight can affect the production. Then another thing which you people need to do is to use loose pants. Some people use tight pants, very tight, and then they create a high temperature there. When the temperature increases, I told you, when the temperature of the testicles is risen, then it will affect the vitality, it will affect the motility, and even the count of your cells in every release. And therefore, you should use loose pants, loose boxers, those cotton boxers that are loose are the best for you. Something else you can do is looking at the food. Eat foods that are rich in vitamin C, D, and E, because research has shown that vitamin C, D, and E contribute to a high production of our cells. And then lastly, on what you can do at home is to increase the number of times or the frequency you're having sexual intercourse. Why? Remember, you have low sperm count. And therefore, what you need to do is to have it several times. When you have it several times, it means you're increasing the chances of even those small amounts you're having to go and hit the target. Those are the things you can do at home in order to increase the level of your sperm count. I told you, if you'd like to have a private chat, an online consultation with me, go to my website and book an appointment on www.druthuman.com. We shall chat on WhatsApp, on Facebook, privately, if your appointment passes through. And if you'd like to chat with us on all other social media platforms, we are available. And if you're a new person on this platform, please don't forget to subscribe and also press the notification bell in order to be notified when we upload any new video. I sign out.
Ask Dr.